This is part 1. Hello, how you doing? This is Bill Santos. Today is August 23rd, 2024. And I've been trying to get myself motivated to perform 2 lung exercises. I have 2 plastic contraptions here. This is the one here. This is the one where I just blow out. This is strengthen my lungs. On the exhale, I guess, or blowing out. It's not that easy. And I have the other one here where I suck air in. I'll show you. What's that about there? I can't remember now. Jeez. That's a little better. The more I do it, the better it gets. The stronger my lungs get. I'm supposed to do this 10 times every hour, but I really haven't been doing that. I haven't been doing it really at all. I need to get busy doing that. I was recently in the hospital with congestive heart failure. I've been prescribed. I received some strong intravenous and oral and diuretic Lasix, and just peed out a lot of water. I had a lot of edema in my legs. I came home. I'm double the dose on the furosemide, which is the Lasix, that I was taking, but I'm half the dose that I had in the hospital, and it seems to be working a lot better. I also have restrictive lung disease. Restrictive lung disease. I was recently diagnosed with that because I had thought that I had asthma, which is obstructive lung disease, but my pulmonologist said that I have restrictive. So I continue to take what is it called? Albuterol sulfate with a nebulizer, and also emergency inhaler. I'm taking Brio, which is a powder version that I inhale. Nebulizer makes a medicated mist that I inhale. The Brio is a powder of the albuterol, where the nebulizer uses a liquid version. The Brio also has a steroid in there. So, and I received intravenous steroids and steroid pills in the hospital also. The Brio, you can hear, makes my voice a little bit scratchy. The albuterol, when I take a lot of it's like drinking several cups of caffeinated coffee. It makes me kind of jittery. But that's the plan. Just continue with that and do the lung exercises. I'm still kind of bedbound mostly because of, I guess, because of weakness. I had the 2 spinal surgeries last year. Then the year before, I had the quadruple bypass heart surgery and 2 chest surgeries. And actually, this year, this past April, I had an ankle surgery, the right ankle. So I'm still kind of weak, but I'm stronger than I was. I'm not really in any pain anymore, thank God for that. And just want to thank my mom and my wife for all their help. Do one more time here. Anyway, have a good day, and I hope I'm in the frame of this video. If I'm not, then I'm just going to post it anyway, because you're going to get the idea. Because I got this one going. Oh. And my fart machine. Thanks for watching. Bye for now. This is part 2. Hello, it's me again, Bill Santos, and I just wanted to pop back on, because I didn't think I explained everything as much as I wanted to, actually, so I'll just mention that the albuterol sulfate that I use to inhale as the medical mist and as the powder also, and as the emergency inhaler. Is a bronchodilator, and it basically reduces the tightness in the lungs, so the lungs are able to expand more easily and get more air and more oxygen into the lungs, so you get more oxygen into the bloodstream, basically. The steroids, they're an anti-inflammatory medication. Sorry. Which means they reduce inflammation within the lungs. I also wanted to explain very quickly the fraction ejection of my heart is very low. The fraction ejection is a percentage of the heart's ability to pump blood throughout the body. Before my heart surgery in 2022, it was about 33%, which is dangerously low. When I had ultrasound of my heart a week or two ago in the hospital, it was determined that it was 37.5. I think it was my cardiologist, and I think another cardiologist said that 35% and lower was dangerous. So I'm at 37.5, but I checked online, and they're saying, in their graphics and stuff, saying that 40% and lower is dangerous. So I'm still kind of in there. I'm taking the 2 heart medications. One is for heart and diabetes together, actually, which is good because I do have diabetes. And the other one, it's called Entresto, which is supposed to be a miracle drug to strengthen the heart and make it pump blood, more volumes of blood through your body. And after I'm done talking here, I'll show you a graphic of the different ranges for the fraction ejection. It's hard for me to remember that. I don't know why. And also, just want to mention quickly that my podiatrist wanted me to restart hyperbaric therapy. That's where they put you in a hyperbaric chamber, and they pump oxygen into the chamber at high volume, high pressure, and you kind of lie there, and your body absorbs it, and you breathe it in, and you sit there about 2 hours. I did it. It was 3 times a week for several weeks, and I don't know if it helped, but it's supposed to reduce or eliminate infections within the body. And I've had a lot of infections. Also, sorry. Just mention quickly, it was talking about me getting a defibrillator installed in my body to strengthen my heart's output. But there was some kind of conflict because I've had a lot of infections in my body in the recent past. I had blood infections, bone infections, and that's osteomyelitis, and cellulitis, which is infections under the skin. In my feet and legs. Actually, I had osteomyelitis in my spine also. But anyway, and I had 4 surgeries on my foot. 3 to remove pieces of bone because of osteomyelitis, the bone infection, and 1 time to remove a tumor that was growing inside of a diabetic ulcer. I've had diabetic ulcers on both of my feet, and which has resulted in infections. Anyway, the one of the cardiologists checked with my infectious disease doctor to find out if I'm still prone to infections. Because if they put the defibrillator in my body and I get an infection, there's going to be an infection in some part of the defibrillator, and it could cause a very serious surgery. And so they don't want to put it in if I'm going to get another infection, if they think I'm going to get another infection. Anyway, I'm taking the heart medication, which is apparently strengthening my heart, and I think I'm going to be okay without the defibrillator. I don't know. I'm just going to say it. I do these videos and I talk and don't pay attention to what I'm saying. So I'm not sure if I mentioned this, but I'll say it again. Then if I did, right after I'm done talking here, I'll show you a graphic of the ranges for the FE fraction ejection, and then I'll show you a picture or photo of a hyperbaric chamber that I have used a fair amount of times, fairly recently. I think in the last, I don't remember what it was, 2 or 3 years ago, maybe. I don't know. I think it might have been 2021 even, before my heart surgery, I think. But it's supposed to get rid of infections, and as far as I know, I don't have any. My podiatrist still has me taking oral antibiotics, but I'll get with him maybe today or sometime next week. I think he's going to make a house call either today or next week. And we can kind of figure out what's going on with that. Anyway, that's all. If you made it this far, thanks for watching, and I really appreciate it. Bye for now.